Look at how well she's sitting up on her forearms.
Wow, how old is your baby? My baby can't do that.
My baby is 13 months, 12 days, and 7 hours old.
My baby's also that age and he can't do that. Is that normal?
AIMS is a tool that can indicate if your baby is typically developing or atypically developing. This outcome measure will give you a super valid and reliable results that will help guide your treatment going forward from here. In fact, the validity for identifying infants with atypical movement was 89%. And just before you think it can't get any better, the reliability was found to be greater than 0.9 for both trained and untrained raters. This is an outcome measure that has primary focus on activity limitations when looking at the ICF model, which is great as this can help us come up with so many treatment ideas and know where some children are lagging behind compared to their peers. Just to give you a little bit more information, in case you're not completely sold on this outcome measure, the AIMS is based on a normative reference which compares the patient to their expected age and sex.
Well, this sounds great, but how expensive is it? And how long is it gonna?
Great thing you mentioned that. This only takes about 10 to 20 minutes to administer the whole test. There is no cost to administer this test, but a pack of 50 scoring booklets can be purchased online for $50. But if you have an official scoring booklet isn't important to you, then scoring sheets can be printed online for free.
That sounds great and all, but how does this outcome measure actually work?
Well, I'll tell you. This outcome measure is purely observational. So if you don't like doing any physical activity, this is perfect for you. There are 58 different items in 4 subcategories of different positions that you would want to see your infant perform. The items are labeled as observed or not observed. And the scores are added up at the end and compared to a normative value.
Listed are the postures that they will be tested in, and any healthcare professional can perform this with any knowledge of infant motor development. Frantafria et al. Suggests AIMS is an assessment tool indicated to identify atypical motor development in at-risk infants.
Well, this all sounds too good to be true. Surely there's some kind of crazy equipment you have to get.
The only equipment needed is a room with minimal outside distractions and can be done in the clinic or at home, as well as a mat, a bench or a chair for the baby to stand on to complete all required postures. And of course, a few toys are allowed to help prompt the infant into different postures, but the infant should not be facilitated into them. This test can also be done at any point and as often as you need to test the infant's motor abilities.
Remember, guys,
You
can always use AIMS to see your child's gains.